Are we live? On the air? Looks like we're rolling. Okay. Well, it doesn't look like that many people have reviewed my past videos for the past couple of days. Um, but that's okay. I'm going to persevere regardless of the view count levels. Right now, my last video I made a couple of days ago has 5 views so far. I think at least a couple of them are my own views. Maybe 3 unique views. That's a start. It hasn't changed though since yesterday. It still shows 5 views. Oh well. We're gonna still continue with these informative video essays. I try to do at least one a day. Yesterday I skipped yesterday, so I'll have to do at least 2 today to make up for that. Today's topic is healthcare. Is it a utility? Um, I'm tending to think that it is a utility, and that has some importance in regards to how it is treated by the economy. Whether it should still be treated as a competitive capitalistic enterprise, or should it be something that's taken over by the public, by the people, in the form of a government-run healthcare system? And is an argument in favor of making it a utility. Even Hayek, in his Road to Serfdom, reluctantly agreed that regular utilities are perhaps best served by being run by the government due to the difficulty of creating a competitive marketplace for them for such things as roads, fresh water supply, sewage, electrical service, phone service. Those are all utilities, and frequently they are run by private companies as what is regarded as a well-regulated monopoly, well-regulated by the government, so that they are only allowed to mark up the price above the cost of their service by what is judged by government officials as a reasonable level. They can't just jack up the price indefinitely as long as people are able to pay that price. Which brings us to healthcare, where it seems like we have encountered many situations where the price of both the drugs, medical supplies, hard goods, and as a result, also the means to pay for those services through insurance providers, the prices have kept going up very high, especially in the case of the medical, the pharmaceuticals and the medical supplies, medical parts. There's been some rather highly publicized incidents where the prices of those products have just been jacked up, apparently by the companies that are manufacturing the product, up to a level that they, as high as they want to, as high as they think that people are going to be willing and able to pay for them, to levels that have seemed to be rather absurd. But since pharmaceuticals and medical devices are not considered a well-regulated monopoly, they're supposed to be considered a part of a competitive marketplace, but effectively that has not been the case. Even in the two most recent instances, there's one particular drug that was offered by a pharmaceutical company that was not even any longer a patented protection, but still it just happened to be the case where that drug, only one manufacturer supplied that drug, and as a result, and it was a very highly needed drug. It was no luxury. It was very considered very necessary to. I believe it was a pediatric medicine for some hospitalized patients that needed that drug to basically they needed it just to for their basic health, a critical drug. But the drug company that had the monopoly on it, and it jacked up the price extremely high, many times. And then the most recent for medical devices was the EpiPen issue, where they were charging $300 for a pair of EpiPens. These little plastic devices that did not look like they cost that much. I'm sure they did not to manufacture anywhere near that price. And now the manufacturer has agreed to provide a lower cost version, but only about half the price of the other one. I believe it was. I think was it $300 for the original EpiPen they were charging, and now they're charging a discount version for like $150. But it seems to be absurdly high for a little plastic device. So I think those are instances where it would be warranted to just in something that's not the public's is not, and not many people are talking about the possibility of the government taking over the manufacture and distribution of pharmaceuticals and medical devices where there's been a huge markup. I think that's something that could be done and should be done. Some institution like the NIH could conceivably manufacture and distribute, especially pharmaceuticals and medical devices, especially in cases where there's no longer patent protection. There's already precedents, not in the medical field, but the government publishing office, as it is now known, I believe it used to be called the government printing office. They are part of the U.S. federal government, and they manufacture, they print, and distribute. They also act as they hire authors, people to write books, pamphlets, brochures, and they print them out, bind them up, and sell them to the public. Anybody can go to the government publishing office online and order. They have a plethora of products they offer. You pay a reasonable price, and you can get a book, pamphlet, or brochure from them, or maybe maps. I think they also print out posters, maps, all sorts of things that are in the printing realm. And then you maybe I think they also offer digital versions of some books too. But anyways, you can buy them from the government. So the government has for many decades and currently continues to, at least in one instance, manufacture. They own the means of production, and they sell and distribute a product directly to the public. That would be a good precedent that could be followed in the realm of pharmaceuticals and medical devices, where a institution like the National Institutes of Health could both manufacture and distribute pharmaceuticals and medical devices directly to the patients. I don't understand why there's always this constant assumption that in order to get the needed medical product to the patient, that product has to be brought to market in order to get it to the patient. Why is it assumed that that's only the way to do that? Why not find a way to get the product, the drug or medical device, directly to the patient? Skip the middleman. There's no law of physics that mandates, that requires something you put on the competitive marketplace in order to get it to the patient that needs it. If a drug company is marking up something too high, instead of having these congressional hearings where the senators and congressmen just all they do is bellyache and plead and whine about how these big bad drug companies are marking up the price way too high, but then turn around And the congressmen and senators, they don't do anything. Everything basically stays the same. All they do is just blow a lot of hot air. There's no results. So why not, instead of just blowing a lot of hot air, do something that's decide who's in charge. Are the drug companies and medical device manufacturers in charge? Right now, they're letting them be in charge. The government, our so-called representatives, are just letting the pharmaceuticals companies and medical device manufacturers, they're letting them be in charge. They just keep our representatives just keep complaining, but they don't do anything. Something they could do is mandate that a government institution like the NIH start manufacturing and distributing such pharmaceuticals and medical devices that are needed by the public, but are not being provided to the public at a reasonable price. There are instances where the things that are needed by the public, which is a utilitarian need, just like we need a water, sewage service, fire department, but are not being provided to the public at a reasonable price as dictated by a competitive marketplace. I just heard recently on Thom Hartmann's program where he was comparing a fire department with healthcare. So why can't we have we can have our houses protected and they do a good job of it too. Fire departments generally, even the right wing, they admit that a fire department does a good job at what they do, their services they provide. Just because it's the government doesn't mean like people just lounge around and have no motivation to do anything. Just the opposite. There's a lot of great admiration on both sides of the political spectrum for things that the government-run fire departments around the country, what they do, and they do a good job. So if they can do a good job at protecting our houses, and they also provide a lot of medical paramedic services and other services. So if they do such a good job at protecting our lives and our houses, and do it not in a competitive marketplace situation, but rather as a government run by the people, a public operation such as the fire department, if they can do such a good job, why can't the same parallel happen in the medical field in terms of hospitals and in the payment and other healthcare clinics, and also the how we go about paying for those services in terms of a single payer government operation that could be analogous to a fire department. Both the care for the patients and the payment for those services could all be done under the public realm. But I would like to emphasize that I wish there would be more coverage, or any coverage. Anybody else besides me suggest the possibility of taking that to far enough to the level where the means of production and distribution can be taken on solely, or at least partially, on the public level, where the manufacturing and distribution of pharmaceuticals and medical devices could be taken over by the government, and so that it be treated as a utilitarian need, a utility, where it's given the premise that medicine is a need and not a want, and so as a result, um, a competitive marketplace does not work, just as it doesn't work in other utilities such as roads, um, streets, yeah, sewage, water, electricity. We could that it should be treated as both the payment of the care of the patients and also the products that they use could all be within the realm of the public domain. And on that point, I'd also like to bring up the issue of the current Stand Up to Cancer movement, which uses the analogy of the moonshots. They say they're trying to do a moonshot level effort to reach a cure for cancer. But what they're not mentioning, and they fail to mention, is that the original moonshot program that they're making an analogy of, that original program was from start to finish a government owned and operated operation. So why not do that? Why, if they did such a good job reaching the moon that NASA did, why can't the public also realize that a similar moonshot program would be best done as a government operation? Best way to reach a destination is to keep the capitalists out of the way, that they only interfere. They're only out for the money. They're not out for the end goal results of reaching that destination that they're hoping for. And so they should make the moonshot program truly analogous to the original NASA Apollo 11 moonshot effort, and make it entirely a government-owned and operated operation, where both the research and development would be on the level of a government program. And but there is also some differences in the analogy there with the moonshots program. With the moonshot program, we could be pretty confident nobody else would reach the moon. Everybody would have known about it, but there has been allegations where some people, there's been a lot of belief, and I tend to agree that there may be instances where we've already reached that moon. What I mean by that is that we've already found a cure for cancer, but it's not being widely publicized because it's not profitable for the pharmaceutical companies. One possibility I've read about is what is known as the baking soda treatment for cancer, that has, from the accounts that I've read, has had some very good results. But of course, baking soda is extremely cheap. I think I read that the entire program can be completed in. It uses just like 3 pounds of baking soda throughout the entire course of treatment, and you can get a pound of baking soda for like 60-70 cents at the supermarket. But the typical protocol for cancer treatment right now, from what I've read, I think the average cost is like $150,000 or so, which is of course extremely high, but it also provides a lot of revenue for the pharmaceutical companies and clinics, so that there's a disincentive to explore options like baking soda to find out whether it works or not through mainstream medicine, because mainstream medicine has become very oriented towards it's very designed to find innovative ways to make a profit. It's not designed specifically to find innovative ways to cure people. It's fundamentally, first and foremost, our current medical system is designed to make profits for for pharmaceutical companies, medical device manufacturers, and to a lesser extent to the institutions like hospitals and clinics. But it's very much that it's not set up to first, it's not set up to help people. It's set up to make profits, and then the assumption is that it's going to help people also, that they will be carried along with it. People will be helped in return for the profits by the made by these big big pharma, that people are going to be automatically helped. And I don't think that's a safe assumption. I think it can be the opposite can be true. That what's best for the pharmaceutical companies isn't necessarily best for what's the public, for the patients. But yet the assumption continues, and it's not tested, that assumption that the health of the patient follows the health of the big pharma corporations. But hopefully that'll change soon. I guess this video has gone on longer than I planned on it, so I better wrap this up. Thank you for viewing, if anybody at all does view this whole video. Thank you so much. If anybody at all watches it. I don't know if anybody will. Besides me.